Good morning everyone. The next topic that we're going to discuss today is mumps. So what is mumps? So mump, the word mump, it is a British word. It is a British word, grimace or grin. The meaning of this word grimace or grin is a result of parotid gland swelling. So the definition of mumps goes on like this. So mumps, it is an acute infectious disease caused due to the virus called myxovirus parotiditis. So this virus is an RNA paramyxovirus. It is affecting mainly the glands and the nervous system. It is affecting mainly the glands and the nervous system. So mortality in the disease mumps is very less. So you can see it in the picture clearly. So the left child is a healthy child and the right child is the child who is infected with mumps. The left one is an healthy child. You can see the clear variation between the facial features of healthy child and the child infected with mumps. And the other picture also I am showing you. You can see the healthy patient, and the same patient when he is infected with mumps, you can see the facial changes, mainly the swelling. This is due to the swelling of parotid glands. So coming to the agent factors. So what is the agent factor in mumps? The agent is myxovirus parotiditis. So what I said earlier, it is a virus which is belonging to RNA. It is a virus which is belonging to RNA paramyxovirus. The agent factor is myxovirus parotiditis, and it is belonging to the family RNA paramyxovirus. So coming to the source of infection. What is the source of infection here? The source of infection is clinical and subclinical cases. So mainly saliva, blood, urine, human milk and CSF, cerebrospinal fluid. So the incubation period of this mumps is 2 to 4 weeks approximately. The incubation period is 2 to 4 weeks approximately. So based on that we can go for the period of communicability. The period of communicability is 4 to 6 days of onset of symptoms and to 7 days after. So it means, so before the symptom is occurring on the patient, the person is able to infect the other person before the 4 to 6 days of initial appearance of symptoms. Before he is exhibiting the symptoms of mumps, he is becoming the source of infection here. And once the symptoms are appearing in the affected person, he is able to infect the other person up to 7 days. Means before the onset of symptom he is able to infect from 4 to 6 days, and after the onset of symptoms he is able to infect the other persons for another 7 days. Maximum just before and at the onset of parotid swelling. So the secondary attack rate is 86%. Since it is a contagious disease and mainly the source of infection is clinical and subclinical cases, the secondary attack rate is about 86%. Coming to the host factors. So the age group which is mainly affected is 5 to 9 years old. The age group between 5 to 9 years is mainly affected, and you can see the case of mumps at any age. Means all the age groups are susceptible, but mainly to the age group of 5 to 9 they are more at danger. Coming to the gender base, females are more infected compared to the males. So coming to the immunity, infants will get protected from the immunity which is passed from the mother during their birth. So less than 6 months of age infants are immune. So the children who are less than 6 months of age are immune. Lifelong immunity after one infection. So same like chickenpox. Once the disease is occurring to you, your body will start to produce antibodies against it, so that there is no secondary infection in the person. Coming to the environmental factors, anytime but peak in winter and spring season. So mumps can occur at any time, but it will reach peak stage in week and spring season. And the other factor is overcrowding. Because it is a contagious disease, whenever there is overcrowding, so you can see more number of cases. What is the mode of transmission? It is a droplet infection and direct contact with the infected person. The mode of transmission is mainly the droplet infection and direct contact with the infected person. So as I said earlier, what is the main source of infection? The main source of infection is clinical and subclinical cases of mumps. Complications of mumps. The complications of mumps are frequent but not serious. The following are the complications. The first one is orchitis. Orchitis means it is an inflammation of one or both testicles. That means unilateral or bilateral. It is occurring 7 to 10 days after parotitis with high fever. So you can see in the slide here, unilateral in 75% orchitis cases. Means if a person is having orchitis due to the result of mumps, in most of the cases, means for 75% of the patient it is unilateral. And the second one is epididymitis. What is epididymitis? It is an inflammation of coil tube epididymis. It is present at the back of the testicles that store and carries sperm. So what is epididymitis means? It is the inflammation of epididymis. Epididymis is present at the back of the testicles. It is mainly responsible for the storage and carrying of the sperm. And the next thing is pancreatitis. Next one is pancreatitis. And mild form of meningitis, thyroiditis, neuritis, hepatitis, ovaritis, wooferitis, and spontaneous abortion in case of pregnancy. These are the complications of mumps. And in rare cases, you can see hearing loss, polyarthritis, encephalitis, and cerebellar ataxia. So these are the complications of mumps. Coming to the management. Management is mainly supportive thing, and case should be isolated till the symptoms subside. Why we should isolate the case means, since the patient is contagious before the onset of symptoms, that is for 4 to 7 days, and once the symptoms are occurring, he is able to infect the other persons for about 7 days further. So in order to prevent this infection, the main thing is we need to isolate the patient, and contact should be kept under surveillance. If any person who is who is coming contact to the infected person, he should be kept under surveillance. So what is the prevention of mumps? The prevention of mumps is mainly through vaccination, that means immunization. So mumps vaccine is live attenuated vaccine. It is about 0.5 ml. It is given through IM. It is given along with measles and rubella. So the vaccine is called as MMR vaccine.